President Lyndon B. signed the health insurance programs into law 5 decades ago. Today, about 55 million Americans have Medicare and more than 70 million have Medicaid, called Medi-Cal in California. But as the country's population grows older, some fear the programs may not be viable in the future. Joining me with a look back and forward is my guest, Susan Chanik, Director of the Institute of Health Studies at California Western School of Law. And Susan, Medicare is credited with transforming medical care here in the U.S. What has it accomplished?
It's accomplished an enormous amount. Before Medicare, at least 50% of seniors didn't have health insurance. And so that if they had illnesses and they had to be in the hospital and that sort of thing, it was really devastating for them financially. And they couldn't get insurance because they were older, no longer working, not eligible for employer-sponsored insurance, or private insurance for that matter, because they were bad risks for the private insurers. So Medicare really changed the world of access to health care for seniors.
For seniors. Now, today's Medicare certainly looks a lot different than it did back in 1965. How has it changed over the last 50 years, the actual program itself?
The actual program itself has expanded. The population in the program is somewhat different because life expectancy is so much longer now than it was in 1965. So that there are people who stay in the program longer and can and use the facilities of the program. And in addition to that, people are older. There are really elderly people. About I think 20% of Medicare beneficiaries are over the age of 85. So these are people who really have a lot of health care needs and therefore high healthcare costs. So that's changed. In addition to which, there are benefits that have been added. A population of permanently disabled people now are covered by Medicare, who can be under the age of 65. People with end-stage kidney disease are covered by Medicare, even though they're under the age of 65. There's now a outpatient prescription drug benefit that's available to Medicare beneficiaries that was not available in the beginning.
Sure. So you mentioned this expanding older age population because we're living longer. Are there other challenges for the program for Medicare?
Besides the old, yes, I think there probably are challenges for any program that's been in effect for 50 years, and it's sort of amazing that this program has been in effect for 50 years. It makes me feel old. But yeah, I think that there are all kinds of challenges. One challenge is cost. The program, when it was first went into effect, cost $3 billion a year. When in this year or in 2014, the cost was more like $600 billion. So the cost has really risen. But of course, all healthcare costs have risen. It's not Medicare itself, but all healthcare costs.
Sure, and that's my question. What's behind Medicare's escalating cost? Is it the healthcare escalating the cost there, or are there other issues as well?
Yeah, I think that there are all kinds of issues. I think there are issues of reimbursement, which haven't been done as artfully as they might be, and it's something that Medicare is really working on. But I think there are other kinds of issues like technology, ever-increasing technology, and people wanting whatever it is that's the new cutting-edge kind of technology that makes all healthcare very expensive.
A lot more expensive. And going on that note, then, the big question in people's mind is Medicare financially sustainable? And if it is, what's being done to keep Medicare around for future generations?
Well, I think Medicare is sustainable. I mean, it's an entitlement program, and the government can decide, or the people can decide, that they're going to spend whatever it takes to cover all of these seniors. So it's not a program that's going to go away unless we all decide that it should be going away. Secondly, I think there are a lot of things being done to curtail costs. The Affordable Care Act has made a lot of changes and has initiated a lot of programs that are intended to cut costs of Medicare and other in private healthcare as well. And I think there's a lot of now looking into changes in insurance design to deal with what are the benefit gaps of Medicare and the problem of very high out-of-pocket costs for a lot of people who can't afford those out-of-pocket costs.
But you said it here, it's sustainable in the future. I think that's what people wanted to hear. Well, Susan Chanik, thank you so much.
It's lovely. It was nice to be here. Thank you.